Hello, my name is Grecia White. I'm a student at Northeastern in the Transportation Policy class, and I'm going to be talking to you about bus rapid transit post-COVID-19 recovery. So right now, public transit is facing very serious challenges. People are very scared to go on the bus or take the train to go places because they fear that, being amongst so many people is going to make them very susceptible to catch the virus. And, these are very serious health concerns that people have. And so the T has lost quite a bit of ridership due to this, and in turn, quite a bit of money as well. According to a WBUR article done in April, subway ridership was down 92% and bus ridership was down 78% compared to a week back in February before the state of emergency was declared by Governor Baker on March 10th. And people also need to feel safe walking or using their wheelchair to get to the bus. So this is a map of the Healthy Streets initiative in Boston. There's been, more of a focus on the bike lanes and expanding bus stops to give more people space, to practice safe distancing while waiting for the bus. According to Streets blog, the Healthy Streets initiative will make tactical changes to city streets to provide more room for safe physical distancing for pedestrians, bike riders, small businesses, and bus riders. I'm proposing that bus rapid transit could help reduce crowding and increase safety by increasing service frequency, allowing riders to board and onboard quickly, and decreasing the waiting time at bus stops. So this is the BRT system in Mexico City. You can see it here in action. That's when I went last year, and there were several things that I think would really benefit Boston. For example, going back to, making onboarding faster and increasing frequency and reliability. These are not only great, by themselves, but they can also help alleviate all the concerns around COVID and also the traffic concerns that people in Boston have expressed for a number of years now. One feature is that they have elevated platforms, and this makes it easier to get on and off. And this can, decrease the opportunity for overcrowding when boarding and unboarding at the bus stops. Another feature is that people are able to pay for their tickets, their fares, at the bus stops themselves, and they can get on the bus through any door. So this not only makes the on and off boarding time, faster, but this could also allow people to, again, keep their distance from each other. And but one thing to keep in mind is that maybe it could become too popular, as it has become sometimes in Mexico, and it maxes out. So this could, normally this would be a great problem to have, for public transit to be that popular. But right now, not really. So it would just need to be closely monitored so that, again, crowding wouldn't be an issue. So I also think that the BRT lanes could be installed near the healthy streets that we saw in the map before. And, this could really serve to leverage the ongoing efforts that the city is doing and take advantage of the existing infrastructure as a way to complement the BRT efforts. And, this could help the overall user experience of riders by making it easy to access the BRT. This could potentially have, people could be against this. There could be pushback because there would be a loss of car lanes. But I think one way to help with the marketing of the project would be to show a united front. So I am thinking public officials could lend their support by being seen taking the bus or taking the train and making social media posts about it. And I think this could, again, not only bring money to the T, but also again show support. I think that showing public support could also, not just be good for the optics of it, but also to boost the morale and showing solidarity with everyone else who has to take public transit or chooses to take transit. Going back to the financials of the MBTA, right now it's pretty strapped for money. And a system like BRT, it could help with pollution because it uses low emission buses, but it's also much cheaper for the city, than trying to do, like in the meantime, while bigger projects, like bigger rail projects are built, they could cost up to 20 times more, according to a WBUR article. A project like this would need to be implemented pretty quickly. There's a saying in the public sector that's something like, change happens at the speed of trust, but sometimes pressing issues such as a pandemic, they call for things to be addressed much sooner than that. So while there is a great opportunity to act fast, it's very important that the team really makes an honest effort to consult with partners and local nonprofits all along the process. So from start to end, and then even after that. As Sarah Rodriguez says in her article about creating accessible services, she says, we realize there is no silver bullet for creating a truly accessible service. The secret is in continually trying and doing better with residents and prioritizing communities that have been historically underserved. As we know, COVID has disproportionately affected minorities, so this really is super crucial that if the T were to implement something like BRT or some other, project very quickly, that it's important to still really try to engage the public. I think additional research could be done with the BRT system in Bogota, Colombia, called Transmilenio. And in the book, the author shares that, in the book Happy City, the author shares that Transmilenio changed people's behavior, but it did it at a fraction of the cost by giving the formerly lowly bus the highest status on the road. I personally have seen the BRT in its, shiny image. So here you can see this is the BRT bus in Mexico City, and it's very bright red. Like, they had new buses, the inside was very clean, it was new, it was very easy to use, and I have seen what something like this can do as far as changing someone's behavior. This right here is my mom. I don't know if you can see it, but that stop is called La Diana, which is it's the name of a famous statue that sits in the middle of one of the roundabouts there, and my mom's name is Diana. So there was like a connection there. But not only that, even despite that, the system was so great that I convinced her to take the bus, and my mom would never ever have done that. Like, I don't think maybe she's ridden the bus once in her life. Like, it's just not her thing. Like, she views it as, I don't know, just something that she doesn't do. It's like a cultural thing. Which, anywho, the point is, it can do wonders. So I am a fierce advocate because I've seen it work. To wrap up, this is a photo I took of myself taking the orange line in April. As you can see, it was pretty empty. Really, nobody knows how long it will take for the T to go back to pre-pandemic numbers, but as many people have said over the course of the last 2 months, we really can't go back to a new normal because it just simply does not exist. And I think this really is the time to try something new.